So one of the things about ABA that we need to think about is how much dosage or how many hours per week does your child need?
My name is Nancy Marchese. I'm a board-certified doctoral level behavior analyst and a clinical psychologist. My goal is to help 2 million children with autism and their families by transforming their lives, and I can't wait to help you too.
Again, this is driven by your child's individual unique needs. There are really two types of ABA. One is called focused ABA, and the other is called comprehensive ABA. So what's the difference between the two? Well, focused, like it sounds, is a very focused program, meaning that your child only needs to work on a few skills within a focused area, within a given area. Sometimes it can be a couple of areas. What does that mean in terms of hours per week for your child? It means your child doesn't need as many hours per week of therapy because we're prioritizing certain areas for your child. This is typically done with kids who are a little older, but not exclusively for kids who are older, and also even adults and teens. This can also be used for children who are younger. Again, it's driven by the number of skills you want to work on. So that's our focused ABA. It's typically anywhere between 10 to 25 hours a week is the ideal amount of dosage for a child, teen, or adult that is working on those priority skill areas. Then there's another type of ABA. It's called comprehensive ABA. And what we're looking at for comprehensive ABA is that we need to work on a lot more skills across a lot of different skill areas, or sometimes we call them skill domains. What does that translate into? That means that we need more hours per week in order to practice those skills, give feedback, lots of learning opportunities, and ensure that the child really masters a lot of skills across a number of different areas. In terms of logistics, this typically means anywhere from 20 hours a week up. Some people will say 25, some people will say 30 hours a week. It really depends on the child and the clinic that they're working within. So that is typically reserved for children who are a little younger, but not exclusively for kids who are younger. There are children who are older as well that need to work on a number of different skill areas simultaneously. So at the same time, we want to work on all those things at the same time. That leads to more hours per week. That's where we get the 20 hours a week up. That's called comprehensive ABA. So there you have it. There's some decision-making factors between focused versus comprehensive ABA. And ultimately, what it comes down to is the number of hours per week is driven by your child's needs and how many skills you want to be able to work on at the same time. Talk to a board-certified behavior analyst, and they can help you figure out exactly what is the best fit for your child and your family.
There's only so much we could cover in the short amount of time we had today. If you found value in what we talked about, go to breakthroughautism.ca, join our newsletter, and also follow me on my socials.